Welcome to the Applications of Telemedicine. In this module, we will review differences between telemedicine and telehealth and policies associated with telemedicine visits. We will discuss the common applications of telemedicine in a variety of settings. The terms telemedicine and telehealth are often used interchangeably. The key difference is that telemedicine includes services performed by a licensed clinician. Many times, this is a physician or nurse practitioner. Telehealth is a broader term which includes mobile health, peer-to-peer support, and continuing medical education. Telehealth is typically defined as a support service and is often provided by non-clinical health providers, such as medical assistants. This can be seen as supplemental to telemedicine and can include medical education, administrative care, or training. Telehealth incorporates the ability to deliver health education and to offer in-service seminars to both providers and to medical staff. Patient geography is very important, so a discussion about population boundaries and health disparities is essential. Two acronyms, MUA and MUP, are frequently used in telemedicine. A medically underserved area, or MUA, exists where there are too few primary care physicians, healthcare providers, dentists, and mental health providers to care for the population. A medically underserved population, or MUP, exists when a vulnerable subgroup of the population faces extreme barriers to accessing care. It is of value to remember both are government-issued designations and carry important weight for telemedicine policies and reimbursement. The location and general density of physicians is also interesting to the federal and state government because it is used as a metric to determine reimbursement. The term Health Professional Shortage Area, or HPSA, is used when there is a shortage of providers to care for a population, a specialty, or a facility need. You can find if you are in a health professional shortage area by going to the website listed on the slide. Reimbursement policies through Medicare continue to evolve. The years 2018 and 2019 brought sweeping changes to the way this delivery mechanism is reimbursed. The patient's location at the time they see the physician is known as the originating site. This is important because Medicare has historically treated telemedicine almost exclusively as a tool for rural areas. As such, they restricted the areas in which a physician could practice for the most part and receive compensation for services. We will see this is changing from only serving patients in health professional shortage areas to a wider definition. It is important to note for larger states, many of the areas outside the major metropolitan cities are health professional shortage areas and need service. Medicare may still limit who can provide these services. To receive reimbursement for services, Medicare has typically been restrictive about where the patient was located at the time of the visit. Medicare offers codes for wellness visits, but there are very few circumstances in which this code should be utilized. In order to provide a wellness visit that is reimbursable by Medicare, the patient must have access to specialized equipment that allows for a full physical exam. Starting in 2020, Medicare Advantage moved many of the restrictions we see traditionally in Medicare billing and coding, allowing the originating site to be the patient's home. The exceptions for what are reimbursable and what is not can be confusing, so it is always best to consult the appropriate payer when in doubt. In 2019, exceptions were enacted to remove geographic restrictions for the treatment of end-stage renal disease, for the treatment of acute stroke, including a mobile stroke unit, and for the treatment of substance use disorder. For the treatment of acute stroke, a mobile stroke unit is eligible for reimbursement. Additionally, the geographic limitation would not apply for the treatment in any eligible originating sites, including mobile stroke units. The final consideration stipulated by Medicare is regarding the treatment of individuals with substance use disorders, SUDs, or co-occurring mental health disorders. In 2018, Medicare was required to adjust their reimbursement policy for telehealth in treating individuals with substance use disorder or a co-occurring mental health disorder. Specifically, it removed the originating site geographic requirements. Additionally, the home was made an eligible originating site for the purposes of treating these individuals. Since 2018, Medicare patients have had the ability to communicate with their doctors without necessarily going into their physician's office for a full visit. Post-pandemic, patients may now see their providers using telemedicine in any geographic area and from a variety of places, including their homes. With this flexibility, it is possible that beneficiaries can receive clinically appropriate services. The provider must use an interactive audio and video telecommunication system that permits real-time communication between the distant site and the patient's home. Distant site providers who can furnish and get payment for covered telemedicine services subject to state law can include physicians, nurse practitioners, physician assistants, nurse midwives, certified nurse anesthetist, clinical psychologist, clinical social workers, registered dietitians, and nutrition professionals. The reimbursement policies for Medicaid typically follow the ones for Medicare, but in this case they differ slightly and should be noted. Medicaid draws a line between telemedicine, care delivered by a physician or nurse practitioner, and telehealth, care delivered by other licensed providers. Like Medicare, Medicaid is evolving with regards to geographic designations and reimbursement. Rules regarding reimbursement and practice are defined by the scope of your license and the laws within your state. Many states require that the clinician is licensed within the same state to get reimbursement. The patient may be treated while they are at home. Additionally, Medicaid is more strict about whom they reimburse. This list includes a narrow list of physicians who are enrolled in Medicaid or those working under the supervision and direction of the licensed physician, including physician assistants and associates, nurse practitioners, and clinical nurse specialists. Medicaid reimburses the following modalities: synchronous video conferencing and asynchronous store and forward technology with some form of synchronous audio interaction, telephone or otherwise. This could include delivering diagnostic images or clinical results. As mentioned, Medicaid is evolving with regards to geographic designations and reimbursement policies, so it is best to check with your state and medical board for the latest information. However, generally, telehealth services include healthcare services delivered by a licensed health professional through technology. Commonly, you must first enroll in your state's Medicaid program. The following list of professionals that may deliver services include licensed professional counselors, licensed marriage and family therapist, social workers, psychologists, licensed dietitians, occupational therapist, speech therapist, home health agencies, school health and related services, and postdoctoral psychology fellows and pre-doctoral psychology interns under a psychologist's supervision. The required documentation that must be maintained is similar to an in-person practice. Medical records must be maintained for all telemedicine medical services. Documentation for a service provided through telemedicine must be the same as for a comparable in-person service. The required documentation that must be maintained is similar to an in-person practice. Medical records must be maintained for all telemedicine medical services. Documentation for a service provided through telemedicine must be the same as for a comparable in-person service. To note, behavioral health providers typically fall into a special category and are not required to provide documentation to the primary care provider. There are certain pieces of documentation you must secure before starting a telemedicine encounter. One of these is informed consent. In general, informed consent should accomplish the following: tell patients how their privacy and security will be protected, tell them of any potential threats, tell them when services may be terminated and referrals made to in-person care, and if applicable, tell them your billing arrangements, such as you will receive one bill from the hospital, one bill from your physician, and one bill from your specialist. In many states, organizations have simply opted to make their informed consent intentionally broad to include telemedicine. Ultimately, it's up to the provider to assure that patients understand how to protect themselves and their information. Consent forms may need to be adjusted to cover telemedical, telehealth, and remote patient monitoring services. In cases where state policy or federal policies for telemedicine are unclear, it is always advised to consult your medical board. They are well versed in all policies and trump any outside recommendations. A few reminders. Your medical board is responsible for establishing medical practice standards. Your medical board issues your license and can discipline you for violations. Not adhering to standards established by your medical board is seen as unprofessional conduct. However, not adhering to a billing standard established by your insurance company will result in a claim denial. In summary, we discussed the subtleties between the terms telemedicine and telehealth. We defined the importance and distinction between geographic descriptors such as MUA, MUP, and HPSA. Lastly, we reviewed policies related to reimbursement for telemedicine visits. Here are a few questions for review. Is telemedicine defined in the same way as telehealth by both Medicare and Medicaid? What is the acronym given to the area which defines a vulnerable subgroup of the population that faces extreme barriers to accessing care? What does the acronym HPSA mean?